Hi, Dr. Sywick here, one of the physicians at the Pain Center of Arizona, and I'd like to take a few minutes today to tell you about TPC Spine Decompress. It's a minimally invasive solution for patients that have been given a diagnosis of spinal stenosis. Before I tell you a little bit about the procedure, let's figure out what spinal stenosis is. Very simply, it's a narrowing of the canal where the spinal cord and/or the spinal nerve roots run. That narrowing can have several factors. Sometimes it's because there's an inflammation of the disc, sometimes an inflammation of the joints around that spinal canal. And in this particular instance, it can also be because there's a ligament there that has gotten thickened. We call that the ligamentum flavum. In TPC Spine Decompress, we have a very unique approach, a minimally invasive tool where we can go in with a small trocar needle under live X-ray guidance and put some contrast in there and delineate specifically where the location of that narrowing is. We use a small instrument called a rongeur where we can remove excessive bone or tissue and open up the area, and then we simply have this tool that is known as the mild procedure where we can scrape down that redundant or that thickened ligamentum flavum that is pushing on that canal. By the way, that canal narrowing and that pushing of that ligamentum flavum is what the spinal stenosis is, and you are likely feeling that as pain across your back that often can radiate into one or both legs. Patients that have spinal stenosis often have problems with prolonged walking or prolonged standing. Your pain is often relieved if you simply sit down, or even what we call the shopping cart sign. If you find yourself in a grocery store bending over the cart to give yourself some relief from that spinal stenosis, this very well might be a procedure that's helpful for you. We certainly look at simple things first. There's medications and physical therapy and injections that you probably know as epidural steroid injections. But when the conservative therapies fail, and simply because there is an obstruction, there is something causing that narrowing, we have TPC Spine Decompress, a very simple, minimally invasive outpatient procedure. It's a small poke hole and a Band-Aid at the end. The procedure goes in, we find the narrowing, we scrape it away, we take the tools out, put the Band-Aid there, and you're walking out, hopefully pain-free. Thanks for letting me tell you a little bit about TPC Spine Decompress today.